Our first speaker is Paul Davis of Paul Davis Insurance Services. Paul is a 36-year veteran of the insurance industry and is licensed in California and 13 other states. He is also a 27-year member of the National Association of Health Underwriters. He has been publicly recognized for his expertise by clients, colleagues, and publications. We're proud to have Paul as one of our resident foundation and SSG senior specialists. Paul?
Thank you. Can you see my screen?
Yes.
Yes.
Okay. Good morning, everyone. So my topic today is Medicare health plan options. I'm an independent agent. I do not work for the government. I don't work for any insurance companies. We help people make the transition from regular health plans onto Medicare. That's what we do. That's the only type of insurance that we practice. I've got on the line today, Jerry Fisher. So if you post a question in chat, he may respond to it directly, or he may indicate that that's a good question to wait till the very end to talk about, or advise you to give us a call because your question is more specific and complex than the general group would want. Every single person I talk to has some confusion about Medicare. Medicare thinks they made it easy, but they did not. A lot of terminology, a lot of verbiage, different things than anything you've ever experienced before. So one of the things you can acquire is a Medicare and U book. You can download that or order it to be delivered to you. If you're eligible for Medicare, you should have received one directly. First thing I like to talk about is what Medicare costs, because most people are under a misassumption that everyone pays the same thing. Medicare Part A has no cost if you've at least worked 10 years in the US economy and paid taxes. Medicare Part B has a cost for most people of $144.60 a month. However, if your income is higher than these threshold amounts, and this is modified adjusted gross income in the tax year 2018, you can pay more. And I have people in all of these categories. I have people that are retired and their modified adjusted gross income filing jointly is $750,000. I've asked several of them if they'd like to adopt me. I haven't had any takers yet. But that's a pretty high rate for each person. And if you've got a standalone Part D prescription drug plan, or it's built into your Medicare Advantage plan, and you have these income levels, you will also have a corresponding amount that you'll pay as an income-related monthly adjustment amount on Part D. So one from this column and one from this column is what you're going to end up paying per person for Medicare. And again, I find a lot of people don't recognize this. If you are just leaving a job and you have a high income, there is a way to appeal this amount and get it reduced because you've had a change in circumstances. Also be aware if you're a senior and you've just sold a largely appreciated asset like a home, you could have a couple of years where you're going to have this increase due to that affecting your modified adjusted gross income. Medicare basics, I really like to educate my clients because I think the more you know about the basics of Medicare and your options, the better you are prepared to make a good, thoughtful decision. So Medicare is a plan that's designed for people generally that are over 65, but also people that are younger. It's a federal health insurance program run by CMS and part of the US government. The eligibility is over age 65, or if you're under age 65 and you have been disabled for more than 2 years, have end-stage renal disease, or have ALS. Need to be a citizen of the United States or a legal resident for at least 5 consecutive years. Legal resident for 5 years, if you haven't paid into the system, you will have a cost for Medicare Part A, and that can be as high as $450 a month. Part A covers inpatient hospital stays, home health care, hospice care, and skilled nursing. Again, the cost for most people is $0. And you will pay up to $458 a month if you have not paid into the system. Medicare Part B covers doctor visits, lab work, tests, x-rays, chemotherapy, radiation therapy, durable medical equipment, ambulance rides, a whole slew of things under Medicare Part B. And as I indicated, most people are paying $144.60, but you can pay more. The enrollment periods for Medicare or the ability to enroll in Medicare has changed dramatically since COVID-19. A lot of times I could tell people, just go into the Social Security office. Well, they're all closed right now. So The way that we're doing it for most people is we direct them to apply online on socialsecurity.gov. Be aware that you have to answer some security questions, and if you can't remember or can't answer them, then you're going to have a phone conversation. The third option, they are enrolling some people over the phone, and I've seen a mixed result on this as to they're doing that for everyone or only under certain circumstances. The best is to start, if you're just becoming eligible, to go on socialsecurity.gov and try that first. If you're just turning 65, you have a 7-month window, the 3 months before you turn 65, the month you turn 65, and the 3 months after that time. I get calls from 3 or 4 people a week telling me, everyone says I need to do something at 65. What do I need to do? Some of them do need to do something, others don't. So there's a special enrollment period for Medicare. If you're on a group health plan with more than 20 employees, you can generally stay on that plan until you reduce hours or lose those benefits. And at that time, you can enroll in Medicare without any problem, without any penalty whatsoever. Technically, you've got an 8-month time period to enroll after the group coverage ends. I don't recommend waiting that long because you're going to have a gap in coverage. There's a general enrollment period that goes January 1st to March 31st. This is mostly for people that missed it the first time around and they're trying to get caught up. And during this period, you would then be eligible to start Medicare on July 1st. And if you didn't sign up when you were supposed to and you delayed it, you're going to have a 10% penalty for every year you missed it where you should have signed up. So it's important when you turn 65 to really examine this closely. So these are the people that need to enroll in Medicare. If you're under age 65 and on Social Security disability, if you're turning 65 and you don't have any health insurance coverage, if you're turning 65 and you're on an individual plan or on Covered California. Now, people on Covered California sometimes have not wanted to change because they have such a great subsidy, it actually costs them less. But if you don't change when you turn 65, you'll have a big tax bill the next time you file your taxes because they're going to take all that subsidy back because you're no longer eligible for it. If you know someone in that circumstance, have them take a look. And if you don't enroll when you should, again, you wait for the open enrollment period, January 1st to March 31st, and you'll probably pay a penalty. Who does not need to enroll in Medicare at age 65? If you're on a group health plan with more than 20 employees, and you get a certificate from that group that says the prescription drug plan is considered to be creditable for Part D, that means it's at least as good as Part D. And if the benefits are good and they're not costing you much, you should just stay on that group plan. And that's what I counsel, say 90% of the people that call me, they're on a good group health plan, stay on that plan until such time as you leave the company, and then we'll enroll you in Medicare. Once you're on Medicare, then you've got some additional benefits that you should layer on. Just having Medicare alone doesn't make sense for anyone, as far as I'm concerned. So these are the different scenarios that you'd have. You sign up for Original Medicare, Parts A and B, and then you add a prescription drug plan, because Medicare Part A and B doesn't cover drugs at all, other than infusion therapies for chemotherapy. Second option would be you sign up on a Medicare A and B, and you enroll in what's called a Medicare supplement and a standalone Part D prescription drug plan. And the third would be a Medicare Advantage plan, which normally includes coverage for prescription drugs. On all these scenarios, you have to continue paying your Medicare Part B as in boy premiums. Currently in Los Angeles and California, there are 32 Part D prescription drug plans. They're all slightly different. When we're helping people, we shop Medicare.gov and we look at all 32 plans to see which one produces the lowest overall cost. Their monthly premiums range from $12 a month to $118 a month. Most people we have that are on Part D standalone are paying between $20 and $30 a month. If you're on a Medicare Advantage HMO plan, then that Part D is going to usually be incorporated into that plan. Medicare supplement. If you have doctors that are in different networks in different geographic areas, or you visit several states during the course of the year and have providers that you see, Medicare supplement is probably what you're going to want to look at enrolling in. There are some specific guidelines on what is covered in every Medicare supplement plan. Currently, for people that are turning 65 after January 1st of this year, Plan G as in George is the richest plan, and Plan G's benefits would be identical anywhere in the country. So these plans give you access to any Medicare contracted provider anywhere in the city, state, or country, other than those that have exclusive contracts, such as doctors that are affiliated with Kaiser. So it's an enormously large number of doctors that you have access to. These plans have a monthly premium. And for someone just turning 65, you're looking at about $127 a month. For my oldest client who's age 85 or older, they would be paying about $280 a month. So it does go up as you get older. This year we had several plans taken out of the marketplace, and I'll talk more about that in a bit. Medicare Advantage plans. These are the ones you're going to see a lot of commercials on TV for. Well, you already are. They're saturated between political commercials and commercials for Medicare Advantage plans. It seems like that's about 90% of the commercials right now. I've been turning the TV off a lot. Medicare Advantage plans, you assign your Medicare benefits to an insurance company who then becomes your provider of Medicare services. So you no longer have independent use of your Medicare card. In Los Angeles, there are 55 plans, 54 of which are HMO. Most of those plans have zero monthly premium. Most of those plans have zero cost when you see a doctor, either primary or specialist, and zero cost if you're hospitalized. HMO plans also offer an integrated care model where all the doctors share the same information, and there's less likelihood of medication mismanagement, which we'll hear more about in a little while, and a more comprehensive approach. Most of these plans have an out-of-pocket maximum of less than $1,000, so it's not a lot of cost exposure. So Medicare plan enrollment periods, some of these are similar to when you're enrolling in Medicare. The initial enrollment period, the 7-month window is the same. Special enrollment period, you come off a group or you move out of the service area. The annual election period, that's what we're encroaching on right now, October 15th to December 7th. This is the best time for someone to review their Medicare Part D prescription drug plan or Medicare Advantage HMO plan. You have a free and easy way to change from one plan to the other. You can even make multiple choices. Whichever plan you stayed with or enrolled last at December 7th, that's the one you'll start on January 1st. If after January 1st you discover you made a mistake or you aren't on the right Medicare Advantage plan, you have a one-time option between January 1st and March 31st to make a change in your Medicare Advantage plan. If you don't enroll in Medicare Part D when you're first eligible at 65, and you don't have creditable coverage through a group health plan, then eventually when you enroll, you will pay a penalty. It's about 30 cents a month for every month that you miss. Doesn't sound like a lot, but Part D started in 2006, and I have several clients that are paying a penalty of $58.10 a month that they'll pay for the rest of their lives because they didn't sign up when they could have. We want to try to avoid that. There are fewer and fewer people that I see that are on good retiree health plans. I've just gotten several calls this week from people in very disparate circumstances. SSG, AFTRA is letting some people go from their retiree health plan, and instead of a comprehensive plan that they're paying the entire amount, they're asking them all to sign up on Medicare supplement plans and Part D prescription drug plans and just giving them an allowance. Fewer and fewer people have really good retiree health plan options, but when they're really good, I usually recommend they stay with them because once they leave, they can't go back. And they usually have a better Part D prescription drug plan. A lot of people I talk to are LAUSD school teacher retirees, and they have an excellent plan. So on Part D, it's a very convoluted process on who pays what. You could have 4 different prices for the same drug during the course of the year because some Part D plans have a deductible, so you're going to pay the full retail price. Then there's an initial coverage level where you're paying a percentage or a fixed rate. Then there's what they used to call the coverage gap or donut hole. And they say it sort of doesn't exist, but it really kind of does because you're responsible for 25% of the cost of prescriptions during that gap. And once you purchase drugs with a retail price of $6,350 or more, then you're in catastrophic where it drops to 5%. So we factor all this in when we shop for someone for a Part D prescription drug plan. Medicare cost assistant. So if you are ever in a circumstance where you hear someone say that they've stopped taking their prescription drugs because they can't afford them, you need to get a reality check from them. And if they've just chosen to spend money on expensive trips or new cars and big screen TVs as opposed to their drug costs, then they're on their own. But if they legitimately can't afford the cost of prescriptions, there are a number of programs out there to help them, and you should encourage them to explore those. So there are state and federal programs that can help. There is Medi-Cal in California. Every other state calls it Medicaid. And there's low-income subsidy and extra help. There's also Medicare savings programs and PACE, Program for All-Inclusive Care for the Elderly. I'm not going to get into a lot of details on these. We're going to go through some slides that show a little bit what the cost parameters are and eligibility. So in order to be eligible for Medicaid, I highlighted some things here. If you're single, you need to have an income of less than $1,294 a month and assets of less than $2,000. That's liquid assets, doesn't include car, home, some other items. And this is at age 65. If you're under age 65, the threshold to qualify is strictly based on income, no assets. So I encounter dozens of people every year that had Medi-Cal and are turning 65. And it's a little bit murky whether or not they are going to stay on Medi-Cal or not. And there's usually a couple of month lag time until they get an official notification. And then we have to scramble to get them taken care of. If it's a married couple, both spouses, then you have income limit of $1,747 and an asset limit of $3,000. So some people that need assistance they spend their assets. They have assets to start with. They start needing assistance. They have to spend money for drugs. They spend down to where they hit that threshold, and then they become eligible. If you're over 55 and you start receiving benefits from Medi-Cal, then eventually the state is going to want to recoup whatever they've provided to you at your death. So if you own a house or have other assets, know that at some point in time, the state will probably come after that at your demise and want to get paid back. They won't kick out your living spouse out of a house, but at her death or his death, they will come after the value of the house. Eligibility for extra help and low income subsidy. So this is a higher limit and there's several different stratifications. So I've had people that thought they didn't qualify for anything because they only looked at the qualification for Medi-Cal. If you have trouble paying for your prescriptions, you can have a situation where your income is $25,000 and you have assets of $29,000, and it will help pay for your prescription drug costs. So I believe there are a lot of people that have overlooked this and they should take advantage of it. There's another program called Medicare savings accounts, and this, I'm not going to get into this at all because this I have not comprehended fully, other than to know that there's some income levels and resource limits, and if you're within those, there's some programs that you might take a look at that are provided through California. We do all of our shopping on Medicare. Was that the bell?
No.
Oh. We do all of our shopping on Medicare.gov for both the Part D prescription drug plans and for people that are on Medicare Advantage plans that were shopping their Part D component. You can do this yourself as well. You can log on here, you can enter your medications, the pharmacies that you want to go to, and it will rank all the plans from least expensive to most expensive in terms of overall cost, what you're paying in a monthly premium and what the actual cost of prescriptions are. So what's changed in 2020? This year, Medicare Plan F and Plan C are not available if you turn 65 after January 1st of this year. If you are older than that, then you still have access to those plans. If you're on a Plan F, you can continue it. If you are still working, but you turn 65 before January 1st of this year, you can still get a Plan F. So Plan F is the richest plan that's been available since 2010. It has no deductible and no share of cost as long as you're seeing Medicare contracted providers for Medicare covered services. For those people that turn 65 after January 1st of this year, we are mostly putting them on a Plan G as in George. The only difference is Plan G is less costly and it has a $198 deductible that one time a year, once a year, and next year that will probably index up to a little more than $200. What's changing for next year? So I'm not going to go through all of these, but the big news is they've made lower out-of-pocket costs for many insulin on Part D plans. So if you or someone you know is on insulin, you really want to shop your Part D prescription drug plan or your Medicare Advantage plan this year, because you might find an incredibly lower price on the cost of insulin. If you or someone you know has end-stage renal disease, previously there were only select special plans, Medicare Advantage plans, that would take someone who has had end-stage renal disease. Starting January of next year, every Medicare supplement plan is required to take anyone that has end-stage renal disease. So we're going to get a lot more options for people. Acupuncture is now covered, up to 12 acupuncture visits for 90 days for specific low back pain. But I've talked to several acupuncturists and they say it hasn't really rolled out to them yet because it requires a medical doctor to be involved with this, and there aren't that many medical doctors that can also provide acupuncture. Telehealth with COVID-19 has absolutely taken off, and they've embraced it as going forward. That's going to be part of any of these Medicare plans. It's going to be covered. You're going to be able to call a doctor and get service rather than having to go in and see them. Okay, I think that's the highlights there. So there are a lot of factors to consider in how you're going to select your Medicare plan after you've enrolled in Medicare Parts A and B. And we look at the budget, your doctors you want to see, the prescriptions you're taking, how you want to access service, whether you want an HMO plan or you prefer a Medicare supplement plan. If there are additional benefits that you're keen on having, because some plans include vision, dental, hearing, over-the-counter items, whether you're traveling or not, and any gut feelings you have in terms of the type of plan you want. Also, talk to the doctors that you're seeing and ask their opinion on what plan you think might be most suitable. So we're licensed agents, we're independent. We represent most of the major players for Medicare Supplement and Medicare Advantage plans. We have to recertify every year. It's about 40 hours of online certification in order to represent a number of these plans. We do something different than most agents. We not only enroll people, but we offer to reshop them every year during the annual election period for Part D and Medicare Advantage plans, and every year around their birthday in California for Medicare supplement plans, because California has a law that guarantees you the right to change within 60 days of your birthday. So we're constantly reviewing our clients' coverage for these, and we literally save our clients tens, if not hundreds of thousands of dollars a year by performing the service. There's a Medicare enrollment checklist that you can do a screenshot, perhaps. I think we're going to be able to make this available offline, or if you want to email myself or the host of this to ask this to be sent out. And this is just a starting point. If you're on a Medicare plan right now, to kind of do some thoughtful reflection on how that plan is working, what things you'd like to be different, and what you'd like to change for the following time period. So I think that hits the end of my presentation. And now I just have to remember how to get out of stop share.